So today we'll just start off the session. In between, if you want to stop me or you want me to repeat it, kindly do it. I'll be happy to repeat it or, for you guys. Is that fine? Okay, so let me start off with introducing myself. My name is Mehnaz Roshan, and I'll be guiding you specifically into reading modules of OET today, okay? So I'll be sharing a screen. Let me know if you can view it. Okay. Okay. Firstly, welcome on board, okay? Welcome on board, everyone. I'm not gonna say good morning or good evening because we are from different timelines, so I'm just gonna skip that part, okay? Okay. So what is OET? This is the first question, and it's a simple question. Most of us have this doubt. So what is OET? OET is just simply an international English test, right? So how is OET different from other English tests? It is different in terms of medical. So you need to show your medical proficiency in it. It is much more related to your profession. Is that fine? It's an English language related to your profession. Okay, so that's how I have put down into words. It is an international English language test that assesses your language communication skills of health professionals who seek to register and practice in the English speaking environment. Because most of us are non-native speakers of English. When we move to an English speaking land, will we be able to cope up with the environment over there? So that's the main goal of OET. Is that fine? Okay. So OET covers all 4 modules. Those are listening, reading, writing, and speaking. As you know, these are the foundation of English language. So you just need to. It's an international test, so it's not going to be simple. It's going to be a little bit tricky and challenging. So we'll be helping you how to score best. Okay, we need minimal of B grade to get into an English-speaking country, right? So how to get it, we will be helping you, okay, in this course. Okay, I'm going to skip listening part. First, I'll just go to reading as I'm going to detail you on this. So first thing I would like you guys tell you guys is reading. In reading, okay, one more doubt. Is my rate of speech okay? Is it quite fast or it's fine? You're able to understand, right? Or should I slow it down? Okay, I suppose it's understandable. Okay, great. Listening and reading is going to be same for all professions. Okay, whether you're a doctor or a nurse, it's going to be the same. Okay, so it's not too deep into it. So one thing you should remember when doing it is don't try to look into depths rather than superficial. What is given, is it there or not? So don't try to spend a lot of time figuring it out. Is that fine? Because it's same for all professions. Okay, so it's going to be layman and not too deep. It's just checking your understanding of English language. The topics will be, as it says, it's about general healthcare, and it will be same for all different professions. In reading subtest, there are 3 different parts: Part A, Part B, and Part C. Part A will be for 20 minutes, okay, and the rest part will be for totally reading will be for 60 minutes. Is that fine? There'll be 20 questions in Part A, followed by Part B. There'll be 6 questions, and C 16. Okay. So we'll be dealing in detail about each part in upcoming slides. Any doubts in this? 3 parts. First, A part will be for 20 minutes, after which the examiner will be taking your paper, and then you'll be moving forward to B and C. Okay. So part A, as I've told you, it will be for 15 minutes. In this reading part, it will test your ability to skim and scan. Okay, coming to which you can ask me what is skimming and scanning. There are some hi-fi terms, obviously we're not going to use them in our day-to-day vocab. So in reading, we're going to use 3 different types of skills that will be skimming, scanning, and detailed reading. I'll detail you what is skim, what is scan, and what do I mean by detailed reading. When I mean by skimming, I'm just going to read through the line as in fast reading. I'm not going to do a detailed reading. Rather, I'm just going to read it fast. So that is nothing but skimming. What do I mean by scanning? Scanning is I'm just going to look for a particular a specific word or specific, for example, the question is, how many hours do a person sleep? So I'm going to look for the time duration, yes, probably 8 or 9. What is given in the text? I'm not going to read the entire text. So that is scanning. Is it understood? How is skimming and what is scanning? Skimming is simply fast reading and scanning is simply but looking for a specified text. Okay. And what do I mean by detailed reading? Detailed reading you'll be doing mostly in part B and part C of reading. So in that, you need to read in detail, as in you need to get an understanding. You can't read fast or you can scan it. So you need to understand it. So that is when detailed reading comes. Okay, you need to understand there is no skimming and scanning and there is no easy way there. You need to understand, only then you'll be able to answer. So that skill mostly you'll be using in part B and part C. Okay, I know it's a lot to take in, but initially when you start practicing it, you'll feel it easy. As I've told you earlier, if you are any doubts or you feel that it's unclear, please do let me know. Okay. Any doubts so far? Okay, I suppose not. Okay, as I've told you in part A, there are 20 questions and you're gonna try to score maximum in part A because it's gonna be easy for you. Okay, it's not going to be detailed, but it's gonna be easy. Part A is mostly filling the blanks or short answers, where the answers are gonna be direct, rather than part B and C that choose up. So you will feel that all these answers are right. It's kind of tricky to find out which is right. So it will be, most of the words will be similar. Okay, so it's better, you should strive to get maximum marks in part A. Okay, so in part A, the questions that you'll be coming across will be matching questions. Mostly, it will be in the first set. Okay, first 7 questions will be matching questions. And then you'll have short answer questions where you're asked to write in a word or two. So those are nothing but short answer questions. And the last one will be gap filling. Okay, so they will be a sentence and between there'll be a gap and you need to fill it. Okay, so these are the different types of tasks you come across in part A. Okay, so in part A you will be getting 4 tests as in continuous text. Okay, 4 different texts, and you need to read those and get an understanding. Is that understood? I'll just do a thing. After explaining part A, I'll be showing you the question paper and you'll be doing it. So how and what is part A? Not only just the explanation, but also practical use. Is that fine? I'll just stop the screen for a minute. Okay. So as you can see, this is part A and this is how it is. There are 4 different texts, as I've told you. Text A, text B, text C, and text D. Okay, and as I've explained earlier, the first they're going to be you need to match. So these are the headings. So which is it? Is this text from text A or B or C or D? Okay, then as I've told you, they're going to be short answers. As the instruction, kindly do read the instruction. Each answer may include words, numbers, or birth. Okay, so short answers. It's just going to be a short phrase, not a long one. Okay, and this is, you're going to fill this up. Okay, is that fine? So these are 20 questions you're going to get in part A. Okay, understood? One thing, good thing about part A is you don't have to, as I told you, skimming and scanning. So how do I use the skill here? Just read the headings and you need to, read through the lines. When I say read through the lines, what does it mean? I'll just tell you. See, text A. What is text A? It says reduction. So what is it? Just read the first 2 and the last 2 lines to get a better understanding. A clinician can achieve a reduction by close manipulation, in which the displaced bone fragments are pulled together in their anatomical position, restoring alignment by open reduction to a surgical incision. Immobilization. So it's just telling about a procedure. So I got to know that reduction is nothing but a procedure. So just read it. Okay. OET is just looking into your language aspect, specifically your English. How good is your English? Are you able to understand it? Not your medical knowledge. Okay. And the second one will be rehab. So most of us it's a common layman term. We use it, rehab. So what is rehabilitation? So you know it, support, and you can see it. So rehabilitation. And TEC-C. So TEC-C is the complication associated with fractures. So what are the complications here? And what is TEC-D? So TEC-D is pain assessment and management. From this, I get an idea that, okay, if it is something about disability or something, it mostly must be in rehab. It is about management or something, or if I just get to know an idea about management, it's mostly going to be in this TEC-D. Okay. Just reading the heading, you get an idea. So that is nothing, just you get an idea of it. So that's the reason text A is easy compared to that of rest. So here, see, for example, I haven't even read in detail, but I understood to help the patient cope up with disability. So I see this word disability, and obviously no doubt it's going to be in which? In text B, that is rehabilitation. So that is text B. So what I'm going to write? I'm going to write text B here. Okay, just you're going to write B. Is that understood? Did you get this? Part A, any doubts here? Okay, I suppose not. You want me to do another one example or one more from this, or shall we move to the next part? Any doubt, guys? So as you said, I'll just do one more. So let's take the last one. It's internal and external hemorrhage. So hemorrhage. So when is an internal and external hemorrhage? You can just read it. Obviously, it's not going to be in, a management. So complications, or yeah, it can be. And can it be in rehab and reduction? No, obviously the answer is going to be part as in text C. Okay. A hemorrhage is a complication. So this is how you need to look into it. Okay. It's very easy. So you can read it through the lines. As in you read the headings, there you get half of the idea. I'm not saying that everything is in that way. Probably in part A, you need to go through the paragraphs to give answers. In the first one, as I've done, I just took the simple topics that I can see easily so that we could cover the next. The other one, filling the blanks, you need to find a word. Okay, for example, if you want me to do one filling the blanks as in a short answer, let's do that. Okay. So the question says, what can be provided for effective pain management? So pain management. Anyone wants to say in which text is this going to be, this information is going to be? Is it going to be in text A, that is reduction, or text B, that is rehab, C is complication, and the D is something, pain assessment and management. Anyone, a wide guess that where in which text is this information is going to be? What is given for effective pain management? I hope that's the question. What is provided for effective pain management? Anyone? You can text or unmute yourself and say, just to see if you're understanding me or not. Anyone?
Option D.
Yeah, like very good. Option D. Okay, good. Who was it? Thank you. I suppose that was a good. I think that you are understanding it good. So something is given for effective pain management. So here I'm going to do the skimming part. So I'm just going to see what is given for effective pain management. So can you see this? Just read this. Okay. Preemptive analgesia should be provided so that the patient's pain is sufficiently managed. So what should be provided for effective pain management? The answer
Preemptive
is,
analgesia.
yeah, very good, very good, very good. Thank you. Okay, it's preemptive analgesia. So I hope that you understood it, right? So this is, that's what you're going to write. Okay, simple as that. So it's a combination of words or words. So you can write, whenever there's an hyphen, this is counted as one word. So you can write preemptive analgesia. Preemptive is one word and analgesia is other one. Okay. So this is how you do part A. Understand? Take that as an S. Now moving on to part B. Sorry, I suppose that. Okay, this is in detail, as I've told you. In part A, you require to skim and scan, and this is, I have explained you all, I'll just read it. 4 different texts, it will be health related. They are labeled A, B, C, and D, 20 questions relating to the text. And you the text uses vocabulary and structure that is understood by all health professionals. Okay, so all text can be found in workplace of the healthcare professional. Okay, so one of it might be a graph or a table or flowchart. In complication in this, it's see that it's a complication one. It's early, something late that was given. That is a tabular form. So you might get it. An example is diagnostic tools or algorithms, advice given to a patient, dosage for the medication, or treatment kindly. So these are the examples I have written. Just example for you guys to better understand. I hope explaining it with the questions help you understand better. Okay. So part B and C, this is part A, and part B and C together, they are for 45 minutes. What is part B? Again, part B assesses your ability to identify the detail or the main points, and there'll be only 6 questions in this related to healthcare. Okay, it might be a guideline or a manual or an internal communication such as an email or memos. Okay, for each text, there is 1 to 3. Sorry for the mistake. So 3 options, multiple choice questions. To complete the task, you need to identify what it's saying. Okay, so mainly task B and task C, you should remember is most of the time the answer will be mostly indirect or not direct. Okay, most of the time they'll be indirect, and only one answer will be mostly right, and the other 3 are just to confuse you. So one thing I want to say you, okay, most of us here, everyone is a healthcare professions, like a doctor, or mostly everyone is a doctor here, right? And nurses. So remember, OET is just a language test. So we have come across, this is a long way, long path to get a doctor. I think it's a lot of hard work. So OET is very easy compared to that. So if you can crack this, OET will be just a cup of tea to you. So it's just a notion because we don't use it in our day-to-day. Probably reading, we have done that before years. To get a hand on it, that's the reason we need to practice it. But with frequent practice, we can achieve it. It's not a difficult task. Okay? Okay, great. Okay. Text B, so you understood it. So you just say there will be options and you need to read a paragraph, and from that you need to understand what is it saying. Again, like what we did before, I'm going to explain you with an example, okay, to understand better. We'll just do one so that you guys understand it better. Okay, wait, just give me 1 sec. I'll just share the screen with you guys. So we're going to go to part B. So, sorry for that. Okay, we'll just read the instruction first. In this part of the test, there are 6 short extracts relating to work. That's what. You should choose the answer A, B, or C, and you think which is the best that fits here. This is the information. So the following is a dash model. So what is the best answer here? So it's a mercury gravity manometer. So that's what. Always look, don't skip anything. Look into the heading. That will give you an idea and read it, it will give you a better one. So the text says the mercury gravity manometer consists of a calibrated cartridge gas tube that is optically clear, easy to clean, and abrasion resistant. The mercury receiver at the top of the tube communicates with the compression cuff to a rubber tube. When a pressure is exerted on the mercury in the reservoir by pumping the pressure bulb, the mercury in the glass rises and indicates how much pressure the cuff applies against the artery. The manometer is connected to the wall for ease of accurate visualization. So this is what the text says. Okay, good. So these are the options. The first one is manual calibration. And the second one is two gravity calibration, and the last one is wall spig manometer. So which one do you think, anyone, again, which one, you can just guess, otherwise I'll just be telling you, but I just wanted to say, which one you guys think might be a right fit here? I'll be telling you why it's a right fit and from where did I get it, but just to make the session interactive, which one might be the answer for this, or which one is the best fit here? What is this model? Okay, I guess I shouldn't ask that initially. In future classes, we'll have a better interaction. Anyone? Okay, C. Okay, good. Okay, I can see many answers. Yeah, it's C. Okay, answer for this will be C, because from the question you're getting to know that it's a model. And manual calibration, it's not exactly talking about manual calibration or true gravity calibration, but it's just for you to divert your attention. But it's actually talking about a manometer, and that is connected to a wall for ease and accurate visualization. Okay, so the answer will be C. So the following model is what? It will be a wall spig manometer. Okay, as I said, if you got confused with manual calibration, there is a cuff. It is just telling what is it. Okay, what is manual wall spig manometer? There's a cuff, and it's the working that nowhere it says that it's not explaining about manual calibration. It's just explaining about wall spig manometer. Okay, so the nearest answer or the best fit will be wall spig manometer. Understood? Any doubts here? If so, please drop it in chat session. I can get it to you. If you want me to explain it again, or if you have any, if it's not clear, you can let me know. Got it? Okay, thank you. I think you guys got it. So text B and text C, kindly read it. Don't try to skim or skip here. Okay, try to read it because you can find similar words in the choose, as in the options and also there. So if you're trying to run through the lines, it's going to be a problem. So that's how it's different from part A. Got it? Yes? No? Anyone? Okay. And I'll take it as an S, I suppose. So moving on. Getting back to the slide. Okay. So this is part B and part C. So what is part C? Part C assesses your ability to identify detailed meaning and opinion in two texts on topics of interest to healthcare profession. So here, I want you to emphasize on, detailed meaning. It is more, as the task goes, you need to put more concentration on. Okay, task 1, obviously part A you can skim and scan. Part B, you can read it and you can just understand it, try to understand, but in this detailed understanding is required because it will be confusing. Just like a medical entrance exams, you will feel that all 3 options are right. So it's going to be something like that. You will feel all 3 are right. So you'll be like, what is it? So you need to find out how the answer is different and which is the right fit. Okay, they'll be trying to confuse you here. So part C assesses the ability to identify detailed meaning. Again, emphasis on detailed meaning. For each test, you will have the answer. Okay, 8. For first answers, you'll have 4 multiple choice, not 3. Apart, in part B, mostly you'll have 3. Here you'll have 4. Okay, so that's the difference. Okay, and this I will just specify again, which is part C, or it just tests your ability to accurately understand the lexical references and complex phrases within the text. So as the part A, part B, part C, the severity just increases a bit. Okay, but with constant practice, again, you can crack it. To understand it better, I know that explanation is quite, if I explain you with an example, it helps you better. I'll do the same thing. I'll just explain it for you guys. Okay. Okay, last one. I won't take much of it. I'll just explain it with. Okay. So in this, again, unlike part A, there won't be single text, but you will be set specified text, as in which one you should read and what you should read. It will be given. So part C, in this part of the test, there'll be two different texts of an healthcare. From 7 to 22, again, you need to choose answer A, B, and C, and which fits the best. So here is text one. There'll be two texts given. The first is auricular hematoma, and the second one. There'll be the second one next. So as I could see here, according to paragraph 1. So the best part is you don't have to read everything here. You can narrow it down. So specifically they're asking in paragraph 1, what is true about cauliflower ear? So they're asking in paragraph 1, what is true about cauliflower ear? So I want you to look into this. Just read paragraph 1, do a detailed reading, and don't look into the options initially because you're going to get confused. Okay. So this time you can just do a silent reading so that I don't disrupt your reading. And after 2 minutes, I'll give you 2 minutes to read the text, and after which I'll be explaining you the answer in detail. Okay, so this is paragraph 1. It's gonna be a little bit lengthy. Okay. I'm gonna on the timer stop you after 2 minutes. Okay, when you hear the beep sound, I'll just stop. Okay, kindly just read it for 2 minutes. The question is, something is true about cauliflower ears. So you're just gonna look into what is true about cauliflower ear. So there are 30 seconds left, and again, you guys might be thinking, why am I, making a 2 minutes to wait for you? Because again, time management is a crucial criteria, or it's important for us to manage our time. Because OET is time specific and they're not going to give us any extra time. So it's important for us to finish the exam within the given time period. So how do we do it is, text C is going to be a little bit complicated as it's a lot of information and it's confusing. So you can give each question a minimum of 2 minutes. So just try to give 2 minutes each. Okay, initially, and whenever it's a request from my, it's if I should recommend you guys, I would say you one thing: kindly just time yourself every time if you're doing a practice session also, because first it's okay if you cross above 60 minutes, it's totally fine. But try to, after, the next session when you come, try it not to go beyond the first time. First time when you practice, it came around probably 70 minutes. Next time you do a reading, try to not cross above 70, rather come below it. And slowly make sure that you come within 60 minutes. So time management is really important. And task part C. So you can give each question a maximum of 2 minutes. So other one thing is, don't try to spend a lot of time looking in what this word exactly means, rather than understand the overall meaning. That will help you. Okay, here they're not looking for each one-to-one word meaning, but overall, are you able to understand the meaning of that text? Okay, moving on to the question. Sorry for interrupting in between. It was just for you guys to understand that. Okay, so according to paragraph 1, what is true about cauliflower ear? A cauliflower ear results from repetitive blows of the ear. Is it true? Is it repetitive blows? Is the first one true? Or anyone who think that what's the answer? Any suggestions? Or what do you think? Anyone about the answer? Is it from repetitive blows of the ear? Or it occurs due to clotting of blood on the bruised area? Or it occurs because the skin is stripped and is not able to supply oxygen to the cartilage and surrounding area that is badly hit. And D, cauliflower ear may often lead to distortion of the shape of the ear. Which one is true? Anyone? Any suggestions? Or you didn't see the options and you want to again look into the text? Any suggestions, anyone? So I think now it's fine. You can just look into it and let me know. One more time. Okay, I see someone is declining. Okay, B. Okay, good. Anyone else? Okay. It's okay. We will start. So I will explain why. What is the answer? So what is B? Let me see first. The cauliflower ears occurs due to clotting of the blood on a bruised area. So what is true about cauliflower? So the first answer is due to repetitive blow. So it just says either hit directly or receive repetitive blow. So it's either this or this. It's not only repetitive blows, but it can either be a hit that is direct or from receives repetitive blow. For the first answer, it's going to be wrong. Understood? So, and then B, out of which I see, what is cauliflower ears is a deformity of the outer ear that is seen in here, and it occurs again by blow or a repeated blow, and okay, it's enough for a large clump to be grown under the skin. So it's saying everything about what is exactly cauliflower ear. It is a deformity. If left untreated, it results with deformation of the ear, which might last for lifetime. Okay, what is true about cauliflower ear? Which is true, quite true. So, when cauliflower ear may often lead to distortion of the shape of the ear. So this is the answer, because cauliflower ear, what is cauliflower ear? When the condition is already done. So that's when it's called cauliflower ear. So what will happen to it? It leads to the distortion of the shape of the ear. So that is the answer. All this again, they are similar. Kindly look into the text again and see and compare. Some will be contradicting. So only this is direct. So what is it? It's true that it will lead to distortion of the shape of the ear. So this D will be the answer and not A, B, and C. Understood? So that's the reason I said, if you give 2 minutes, time, you will be able to, because one paragraph, obviously it's going to be 150 to 200 words in each. If you're going to spend 2 minutes on, consecutive, you just time yourself and try to finish it in two, you will be able to answer this. Okay? Understood? Okay. So look at the second question. I'll just do, because I feel that you might have doubt in this too. And so in paragraph 1, what does the word contusion imply? So being hit by the opponent, a bruise, a serious injury, a very painful blow. What is it? So where is the word contusion? Again, it's a paragraph. That's the reason I decided to, explain, or I decided to do it. So since most of us have read, where is the word contusion here? Okay. Athletes involved in this any sport can suffer a contusion to the ear may result in cauliflower ear. What is contusion here? So again, everything. You might feel that all three, a contusion, the word means here simply a bruise. If you know the meaning, it's a bruise. But remember, if you don't know the meaning also, it just says that, it leads to cauliflower ear. It's not saying that it's already being hit by an opponent. It can be hit by anything. Okay. And then a serious injury. It is an injury when untreated, it becomes serious. A very painful blow. So what is it first? It is what does the word imply? The implication. What does it say? It just says simply a bruise. So the answer will be a bruise. That will be B here. Understood? Okay. Understood? Any doubts in this? If no, let me know. If yes, please let me know. Anything, whatever you feel is. Anyone? Right. Should I be happy that all of you understanding it right way and there are no doubts? Should I be sad that none of you understood it? So which one of is it right? Is it yes or it's no? Understood. Okay, thank you. I'll take that as a compliment. And moving on further. So mostly we are done with, so you got a wide outline on what text A, B, and part A, B, and C is, right? And how to go about. You got an idea, right? Right? Oh, okay. Okay, I have just explained in detail of what C is. There'll be 2 longer text as we have read. It will be health related text, and there'll be 16 multiple choice related to the same text. And it will, see your ability. If you have understood the text, it will see if you are able to interfere the meaning out of it. And it will also look into if you're able to identify what's the view. Okay. And the text will contain facts or different perspective of the topics, or it can be a case study, or it can be also a research topic, related to healthcare. Everything will be related to healthcare. Is that fine? It's not a general talk. And any questions here? So we are done with reading. I have given you a brief outline on how reading for OET is, and there are 3 parts, and I have explained you 3 in detail, not in detail as in I have given you a detailed idea with a little bit explanation. Okay, do you have any doubts in it? Please let me know. You can feel free to ask anything. It's fine. I can explain you again. Any doubts? Okay, kindly do let me know. Or any doubts? As I've told you initially, you might feel it a bit troublesome to understand, but as you practice it, and there are few traps, as I've said, why is it and why it's not? So constant support, you'll be able to crack it, and you'll be able to, go or fly to your desired dream country, I should say. Okay. Any doubts? I'll give you about 30 seconds. If you have any doubts relating to any part, and just let me know. You can drop a text, or as I've told earlier, unmute yourself and let me know if they are. If not, then I think we are good to go. No doubts? Okay. One more tip for it. So in part A, so part B and part C, obviously you're going to write A, B, or C, or D when it comes to part C. But when it comes to part A, make sure that you write down the phrases right. Okay. Spelling mistakes, you should not, if it's, you won't be given a negative marking if it's wrong. So try to complete as much, try to finish everything so they don't leave any back. So because you're not given any negative marking, right? So try to finish every. So all the answers try to attend that. So because you're not given any negative marking for it, first thing. And when it's short phrases or short words, the answer will be given in those texts. So try to write it. Avoid spelling mistakes. When you're writing paper-based, make sure that your writing is clear. If it's not understandable, it will again be a problem. Specifically, part B and part C are corrected. It are computerized correction, but part A, you need to be a little bit clear. You can't write. If you are writing a cursive writing, make sure that it's understandable enough. Or if your writing is, just try to, because it's only 20 questions. I think we can just try to work on those. Just even if you have bad writing, we can try to work on that. That's fine. Just make sure that it's clear, spacing and writing that part. Is that understood? I suppose you have no doubts, okay? If anyone have any doubt, please do ask me relating reading or any part of it. I wanted to do a bit of listening, but I think we'll do it in the next session because it will be too much to get along. Okay? No doubts? Okay, great. Which is better, paper-based or computer? I'd say it depends on you. So for a person like me, if you ask me, I would prefer paper-based rather than computer because I'm not that quick-witted when it comes to computer. So it's your personal call. There's no difference in it. It's just like the way of writing. If it's paper-based, you're going to write. And if it's computer-based, you're going to type it. That's it. So as per whatever you're good in it, or if you can make up in time when it comes to computer, you can take computer based. That's totally fine. There's no much different. The text, everything is going to be the same. How OET is different from IELTS? As I've told you, and it's both are English language tests, and IELTS is generalized. So a doctor, a engineer, a lawyer, anyone can take IELTS. But OET is specified to your profession. Okay, it's specifically to healthcare professions. Okay, so that's the difference between. Because in IELTS you're gonna write, it will be a general topic that you'll be going to speak on, any general topic, or writing, it will be an essay writing. But in OET, it's just you're writing a letter to a profession. So it's going to be related much more to your field of work rather than general. It's specifically to healthcare professions. For the writing, is IELTS comparatively easier? See, I feel the difference between IELTS and OET writing is, in IELTS, there are two tasks in writing. Whether you take academic or general, task 2 will be the same, that will be an essay writing, and task 1 will differ. For general, it will be a letter writing, and for academic, it will be a graphical representation, which you need to put down into words. So in OET, it's just a letter writing. So one tricky stuff that you need to, find, how to crack or how to get a better score in OET writing is to narrow down the information. There's a lot of information. It's a case history given. So what are you going to write and what not? For example, if you're writing it to a nurse, you're going to mostly emphasize on the care and management part rather than on saying, what happened or what it is. If you're writing to an emergency doctor, you're going to specify the present condition of the patient rather than the past. So tell the present vitals on what are the investigations they need to do rather than saying, their social history or background. So it just sees that are you writing it relating to the question that is given. So that's the difference. Okay. It depends. Okay, if you have, to be frank, yeah, we can, but only with constant practice. You need to spend a good amount of time for that. I will need to see how much or how is your language level, as in if I give you a mock test and if I get a scores, I'll get to know that what are the areas I need to work on. So after which I can tell you, okay, if you're good in listening, I'm gonna say, okay, practice that. And if you need to improve in writing, I'm gonna say, okay, work more on this area, try to write this. Or if you need more, if I need to help you more or assist you more in speaking, I'm gonna emphasize on that. So it depends on how or which is your level, or how much should you work on. And also you need to prepare. If it's within this time limit, we need to spend a minimal time, as in minimum of 2 hours every day. Minimal, if I say minimal, it's mandatory to spend at least 2 hours, because it's only 2 weeks. So we need, I know that every one of us are working professionals and it's really difficult, but we need to find some time to work out. Then obviously you can achieve your goal. But for that, I need to get an idea of where we need to work, or how could we assist you. Okay, if you have doubts, you can just, if you have already booked, you can just get to our team and they'll help you, in further, how to go about and what are the steps needed. They'll guide you. Okay, any other queries that I could help you with? Anyone? Yeah. If not, then I'll just end the session in another 20 seconds. Okay, we are done for today. I hope you found it beneficial and you got a better idea. I'm not saying a detailed idea, it will take time. Idea, whatever you had it, better than that of before, I suppose. Okay.